I think it is a healthcare crisis.
It's poison. More poison, more negative effects.
Death. There was a sense of death.
We're talking about the hidden epidemic.
I lost my soul that day.
It's in my neighborhood. It's in your neighborhood. It's all around us.
Trauma.
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 Trauma. Trauma is a major underlying mechanism for multiple biomedical diseases later in life.
Smoking, obesity, depression, anxiety, bipolar disorder, liver disease, lung disease, prescription medication, heart disease, chronic pain, cancer. What's the cost of dying young?
It can produce an infinite variety of problems for an individual.
What happened to you?
I got shot in the back twice.
We have a heritage of trauma in this nation which is unique.
The consequences can be inherited and passed from one generation to another.
This intense feeling of not being safe and of my life being threatened.
Helplessness is the state where trauma may occur.
Your hopes, your dreams, your future, your career.
The effect of negative life events on a state of helplessness can traumatize that individual in little ways, but in many, many ways.
It is a permanent encoding in the brain, and as a consequence, things which are associated with that event, if brought into the individual's mind, causes the experience to occur as if it's for the first time.
Being hit hard by the hurricane of the trauma probably didn't come for another 9 months to a year.
Negative experiences are stored, and you're going to have symptoms.
You're talking about addiction.
We seem to be drawn to things that are violent and disgusting. It's the behavior of a dissociated nation. We're trying to achieve the endorphin relief from trauma. There's never enough. Trauma is addictive.
What is the mechanism by which this gets better? There has not been one medication shown to be useful for the treatment of traumatization. Treating symptoms doesn't work.
We are creating trauma in patients who come into the hospital system. We become mechanized. We lose the interface between the doctor and the patient. Getting sick will traumatize you more than anything else.
This calls for a paradigm shift in primary care medical practice.
How are we going to teach people how this works so that we don't transmit it to the next generation?
Trauma is epidemic. It is hidden in plain sight.